As a student in the healthcare MBA program here at St. Thomas, what has become to be the most important element is the cohort. Learning as a cohort, coming together as a cohort, being able to grow as an individual, both in the classroom, online, outside of the classroom. The cohort is an element of the program that I think I underestimated. At the start, I thought it sounded like a nice format, and at the end, I see what a critical and essential piece that is. It builds not only additional learnings and allows for additional learnings, but also really to build my network and to really help me discover who I am again as that whole person. For me, looking back at the program, it was definitely the trip to Washington, D.C. with Senator Dave Durenberger and doing a deep dive into healthcare policy. And I remember when we arrived all together in D.C., it was almost a surreal experience of here we all are, picked up off of out of Minnesota and out of the Midwest, and drop back down into Washington, D.C., and you're following along a leader that really transformed and laid the groundwork for a lot of the work that is happening now that we take kind of for granted day by day that's there. So talking to the leaders in Washington, having them ask us questions about, here's something that we're discussing and we're struggling with. What do you think? What does this look like? It's sort of them coming kind of down from the 100,000-foot mount and wanting to say, if we did it this way, would that make sense? Should we maybe do it that way? So you're part of creating policy and implementing policy, not only for ourselves, but for those others that are still coming up as well through the system. It was an amazing, impactful experience to be able to have that on site, and one that I know I'll remember for a long time. It is very much like the blind man feeling an elephant, and it takes all of our experiences and all of our professionals or all of our professions in order to come together and put together that whole elephant to truly understand what the healthcare system is about, and how then can we move it forward. Coming from the insurance industry and coming from that sector of the healthcare system, again, I was concerned at the front that I would be in this position of almost defending my industry. And again, what I found is people really wanted to seek to understand, why does the insurance industry approach healthcare in this manner, or why don't they approach it in that manner? And as we went through the program, there was less of those lines of questions, because not that people I think understood it fully, but I think what they understood was there's a business behind it and there's intention behind it, and no industry goes at it with bad intentions. We come at it with the best of intentions possible, and so how do we bridge those, and how do we come together to really make a true whole healthcare system? To me, the healthcare MBA program was valuable because of the intersection of all the different industries, professionals that come together in the room. There was some folks that are in the cohort and are in the program where at the start you sort of may scratch your head and wonder, what part are they in? And you quickly realize this huge role that they play in the healthcare system that may not be maybe as intuitive at the start, and you realize what a huge role that they play. So it's getting that broader perspective of the healthcare system and how it comes together. Maybe the questions that some different parts of the healthcare system have about other parts, and how that interplay and how that intermixes together. Personally, those fundamental pieces of the MBA program, the finance and the actuary, those are pieces that coming into the program I didn't have any basis for. I may have dabbled in it a little bit, but no real formal training. And I think that was maybe some of the ahas in the program, is that I knew more than what I thought I knew. So I came in saying, I don't know anything about finance. I don't know anything about managerial accounting. And I was doing some of those things without knowing really that that's what I was doing. And so it's really solidifying that kind of real world experience, putting a stronger foundation underneath that so that I can go forth with more confidence in doing those pieces and having a better understanding of those elemental pieces. Coming now at the end of the healthcare MBA program and concluding the 2.5 years, I'm so glad that I did the program, and I would do it all over again if I had the opportunity.